Now, unhealthy lifestyles have been cited as contributing to the development of cancers, with tobacco and alcohol use accounting for 27% of cancer deaths.
So this is according to the Cancer Association of Zimbabwe and their message commemorating World Cancer Day, which ran under the theme, Close the Care Gap.
Now, the association says at least 1/3 of cancers are preventable, and reducing the rates of tobacco and alcohol use, including drug and substance abuse, will significantly decrease the global cancer burden.
So calls for early screening to continue to be made to reduce a late detection. In 2018, the Zimbabwe National Cancer Registry reported that over 80% of cases were diagnosed at advanced stages.
Now, joining us to talk more about this particular topic this morning, we are joined by specialist oncologist, Dr. Nomsa Tsikai. Doctor, thank you so much for joining us.
Good morning, Candice. Thank you so much for having me.
Thank you for taking time out of your day. Now, it is, we've just pointed out that one of the issues that is leading to development of a lot of these cancers these days especially is lifestyle. Now, how does your lifestyle contribute towards the development of cancer?
Thank you for that. That is correct. Lifestyle issues are a major contributor to the increasing numbers of the cancer cases that are going up. So with lifestyle, we are saying, how are we living our lives? What choices are we making daily? So this is from the food that we're eating. We always have to be aware and intentional about what we're taking in. The more processed the food that we're taking in, the more harmful, because you can imagine from its source, through the processing, the chemicals that have been put into that food. So what we always say is the more natural and close to its natural form and source as possible. So processed foods, we mean our tinned beef, our tinned foods, we mean our sausages, our bacon. All that type of food has gone through chemical processing.
Right.
Yes. So if you're having your meat, have it fresh, straight from the cow, from your butchery, your chicken. That's the thing that we're looking at. And even the foods, even the natural foods, we also have to be careful from where they're coming from. Now we have foods that are given animals, chickens, cows, that are given chemicals to make them grow faster.
Right.
Yes. So that also is an issue that over the years we end up suffering from. Some of them are given hormones, just to beef them up. The chickens get bigger and bigger and they grow. Within 5 weeks, they're fully grown. So you can just imagine what those hormones that we're ingesting then do to us over the years. Like we know breast cancer is hormonally driven. So we have from childhood, we're eating foods that are rich in hormones. It then has an impact over the years. And with our foods also, we're looking at the fast foods. A lot of those fast foods, when you just go across the road and you buy fast foods, this is food that you haven't cooked. You can just, you ask yourself, what has gone into that?
Right.
Yes.
And you have very little control over it.
Exactly. The chemicals that they're putting in. Some of these foods, they want them to last. They put preservatives. They've cooked today, but they want that food to be still fresh tomorrow and the day after. So we also have to be careful. With these foods, it's really the quantities that we're taking in. So when we're saying it's a lifestyle, it's those habits that you're doing daily. If you're having your chicken in, your pizza in, your chicken slice, or whatever fast foods you're having, once a week, it's okay. But if it becomes a daily thing that you're saying, for lunch, this is what I do, then it becomes an issue.
Absolutely.
Yes. And also foods that are rich in sugar are not good.
Right. Now, there have been calls worldwide for information to be made public about what goes into the preparation of certain foods in terms of, when you look at your ingredients list, and there should be chemicals and all that. But it's not always easily available, this information. And like you said, the more natural it is, the better. But then you also are exposed to things such as GMOs.
Yes.
Now, how do you as an individual try and control that environment?
Yes. So like you're saying, that definitely it is good if that information was on the package leaflets, on the back of the food packaging, so that you're able to actually know what's going in. But a lot of it, integrity has, with business. It's not so much that you get accurate information. So that's where it comes in that you as an individual have to be empowered and have more of foods that you can either grow yourself or you know that it's coming from a reputable source. So that is where, as the population, we can actually be empowered. A lot of people are now growing their chicken organically, the free-range chickens. So you know that you're not putting in any chemicals. They just, eating natural.
Right,
yes.
right. And that also kind of helps you with the affordability aspect of things as well.
Exactly. It does actually help. Yeah. So with that also, we found that over the decades, a lot of foods, they have sugar put in them. And some of it is not clearly, written. So the problem with sugar, that is very addictive. It's actually been found to be more addictive than our heroin and hard drugs like that. A lot of people are not aware of that.
Yeah, that's an interesting fact.
Yes.
You know what the good doc scared me when she said bacon? Like I've been stuck on that since. I'm like, everything she said,
everything
that's
lifestyle.
I'm like, bacon? But I also know that, I think in the story that we were covering, it says 20% of the cancers that we're seeing now are also from alcohol and smoking. Is that an issue of quantity as well? Can I have just a little bit?
Yes.
Is that an issue of quantity as well?
Yes, so smoking is a no-no. You can just imagine that tobacco has over 200 cancer-causing agents.
What?
Yes,
200?
over 200 cancer-causing chemicals
Where's that?
in tobacco. So you are intentionally, you're not being forced. You are going to buy these cigarettes.
Your own illness.
Yes, and you're smoking it yourself. Not somebody forcing you to say, here, Candice, smoke these 200 cancer-causing agents. Exactly.
Wow.
So when you just remember that I'm voluntarily putting these cancer-causing agents in me, then that should help to actually just stop you dead in your tracks and you stop smoking.
Supposing I've been voluntarily putting this cancer agents, what are some of the symptoms and how can I get screened? Don't look at me like that, like I'm concerned here.
I am concerned for you.
At what point, what are some of the symptoms that you look out for cancer, and where do I get screened? How do I get screened? How does it work? If I want to, I've been having a little bacon, bit of alcohol.
Thank you for that. Yes. So thank you for that. Just to stress a point on the smoking. If it was only just affecting the person who's smoking, but unfortunately it affects the people around you. So smoking is usually done socially. It's done at home when you're relaxing, at work. So when you're smoking, the chemicals that you're exhaling, they even have more damaging effects on the people that are taking it, that are breathing it in. Because as you're smoking, also there's a filter that helps to filter some of the chemicals that are going in. But imagine, your children around you, your partners, yes, your friends, they don't have that filter. So the damage is even worse because it's not just you alone.
Yes, I did want to speak to that. There actually was a study that said that smokers are least affected by their smoking as opposed to the people around them. Secondary smokers are the ones who tend to have the worst effects of smoking.
Exactly. So just for people to be aware of that. When they say, please smoke outside by yourself, please do that. A lot of people still in our restaurants in Zimbabwe, they're still smoking indoors. But the rest of the world, that is now become an act that you cannot smoke within public areas.
Before you answer Tish's question very quickly, when we're talking about, right now we're talking about cigarettes, but now we have this invasion of things, the vapes and the shisha. Are those any safer?
Not really, no. But unfortunately, they've become quite common, rampant, especially amongst the youth. And a lot of them, especially the vapors, these are still new. And unfortunately, within the next 10, 20 years, we will start seeing the effects. And some of it might not be positive effect, negative impact. So and that's the thing with the cancer-causing agents. It's wear and tear over the years. So some of it, the damage shows after 10 years, after 20 years. It's not immediate. So a lot of people start these things when they're young and they feel invincible. They start seeing the effects when they're in their 40s, 50s. That's why cancer usually, it increases in incidence as we get older. The foods that we've been taking, we start seeing that damage as we get older. So the good thing about it is when you know that I have been doing this, I have been smoking, then you know that I'm at risk of lung cancer. So you can go for screening. You watch out for the symptoms, coughing, shortness of breath, chest pain. But regularly, you can actually, as you're having your medical checkups, tell your doctor, I've been a chronic smoker. I've stopped, or I'm still smoking. I'm trying to cut down.
Honesty is key as well.
It's important. And they ask you to have a chest x-ray done to try and detect lung cancer early. So that is the good thing. And for other cancers, diet-related factors, we're also looking at things like red meat. Also, that's been found to be quite significant in terms of cancer causing or cancer risk factor. So with that, we're saying we also want to be screened for colon cancer, one of the common cancers. From the age of 45, we all have to have our scopes. Colon scopes. Put a camera through the anus, through the rectum, through your whole bowel.
Sounds very pleasant.
You are sedated, so not to worry. Yes.
Right.
So they look at your whole bowel to see if there are any lumps that are growing there, which may be cancerous. Once you have that one, if you don't have a strong family history, we can do that every 5 years. But just to remember, 45, at least by 50, everybody should have had that scope done.
Right.
Yes.
All right, Doc, we've also heard that, I don't know if you're here to verify this for us, that some cancers are treatable. We've heard some stories of people saying they've recovered. So what are some of these cancers, if any, that are treatable?
Yes, so we are actually lucky as people that the most common cancers, that is cervical cancer, which is a third of all our cancers, breast cancer, prostate cancer, colon cancer, are actually screenable. The colon cancer, I mentioned that colonoscopy. Breast cancer, women from the age of 40, we advocate that they have their mammograms, special x-ray that squeezes the breast, and that x-ray detects small lumps early before they've even spread. Cervical cancer, we have what we call pap smears. We have VIAC, which is visual inspection with acetic acid, that is put on the cervix to look for any cancerous changes. So that also picks up cancer before it's also spread. Yes, and prostate cancer, men, please, from the age of 45, anybody who's listening to me who's 45 years old, I hope that you've had at least your first PSA test. It's just a simple blood test, sometimes just a pinprick that tells you whether you're at risk or you've got chances of having prostate cancer in less than 5 minutes.
Now, Doc, one of the biggest challenges that we have, especially in Zimbabwe, is access to these services, as we've mentioned in the package itself. You'll find that if I can get access to it, it's beyond my economic reach, or there is no facility at all. I don't even know how to ask you this, but how do we collectively combat this if these are some of the basic problems that we're having?
Thank you. Cancer is on the increase. I think if you're looking at all the diseases, at some point COVID was definitely number one, but cancer is number one in terms of priority for the nation. It has overtaken deaths from HIV, from tuberculosis, from malaria. So as a nation, we have to look at cancer as a top priority, of which our Ministry of Health is doing that already. But we also want the corporates, the people, the populace to also understand that when they're hearing people talking about cancer, they just don't think that it's something that happens next door to somebody else. It is something that can happen to any one of us. So just that awareness is very important. What we want to achieve is early detection. So screening, especially those 4 most common cancers, we want to screen and detect them early. When we detect them early, we catch them sometimes in the precancerous stages where they can just be scraped out without the need for the expensive treatments such as your surgery, radiotherapy, where we're using x-rays to treat cancer, such as your chemotherapy, where we're using chemicals, injections or tablets to treat cancer. So when we catch it early, then the expense becomes much less. And also the emotional toil on the patients and their families, if not just financial, but also emotional, psychological, becomes also much less.
And Doc, you talked about some of these cancers. You only start seeing the symptoms because of wear and tear. When it comes to children, we've heard stories of it affecting children as well. What kind of cancers affect children, and what's the difference between the impact that it has maybe on a child or maybe an old person like myself?
Yes, for children, a lot of it is inherited or genetic. They're actually born with the cancer gene. So what usually causes cancer is a mistake within our cells. Our cells are the basic building blocks of our body. So we're just made of billions and billions of cells. But when one of those cells has a mutation, a mistake in it, that mistake enables that cell to grow and grow uncontrollably. So there may be a trigger when that child is born. The childhood cancers, we see them all the way up to the children are 60, from birth even. So that trigger, if it's genetically acquired, it comes on earlier.
Right.
Yeah, so once you have that trigger, so for children, the most common cancers, brain tumors, eye cancers, what we call retinoblastoma, kidney cancer that we call Wilms tumor, and blood cancers that we call leukemias and lymphomas, cancers of the lymph system. So these cancers, and even the bones also. Right. So these cancers would have had that trigger. Once that trigger starts, these cells are growing uncontrollably. And before you know it, you now have a tumor that you can feel, that you can see. Yes, and the children become unwell. So with children, the problem is a lot of them, they cannot actually express that they are sick.
Right,
so it's important for the caregivers, the parents, the teachers to be aware that there's something is happening. There's some behavioral change.
That are going on.
Yes, the child was active, but now not so active. They're not feeding so well. They're not growing so well. They need to be. You know, we've had instances where some children actually expelled from school, because the teacher is saying, no, they're not listening to me, they're not doing their work.
But
Meanwhile, they had cancer. Yes.
Right.
Yeah. So that's the thing, that some children are not able to actually express. So by the time we pick up, sometimes it's too late. So the Ministry of Health is working with Kids Can, an organization that works with children, helps children with cancer, to actually information dissemination, to give information to the schools, to our rural areas, to say, yes, children, look out for changes in the eyes, look out for behavioral changes. Maybe it's a brain tumor. If they're saying they have a headache, believe them.
Right.
If they're saying they tummy ache, believe them.
Right. Now, Doc, as we conclude, as you've mentioned, of course, you know, there is information that is going out to schools and so on. But how do we bridge that gap? Because one of the biggest problems that, of course, prevents early detection is the lack of information. How do we bridge that gap of information dissemination across the country, whether it is urban or rural communities?
Yes. So the Ministry of Health, with other stakeholders and partners, have come up with a national cancer control plan. So that strategy has incorporated information dissemination. So all the way from your prevention, treatment, access to treatment, they're trying to improve on the infrastructure, on the machinery, equipment, access to cancer drugs. So that information, we are trying to get it out there. So we're doing outreaches, working with our communities, different provincial areas, the districts, to put pamphlets out there, to put posters. We're trying to go on radio, TV, to just get people to know, churches, schools, as much information to the public as we can.
All right. Doctor, thank you so much for sitting down with us and just helping us break that down. And we will, of course, play our part in making sure that you get all the information that you need. That was, of course, us sitting down with a specialist oncologist, Dr. Nomsa Tsikai, to kind of break down what it is that cancer is, how it comes about, and what information you need to know. The message that we are sending out is early detection saves lives. So make sure you are getting screened for whatever it is that you think could affect you. Anything and everything. You go get checked.
Yeah, prostate, bacon, alcohol.
Oh, wow. Okay, you know what?
Like I'm fine.
Yeah, it's okay.
Early screening,
It's
though.
okay. It's okay.
Early screening, and I'm going to go get screened.
Wonderful.
Early screening. So.
Wonderful.